If you are over 50 and you walk regularly, you already deserve credit. Most people your age have given up on staying active. You haven't. But here is something that might surprise you. Something that Dr. Pardip, a physician with over 2 decades of experience in preventive medicine and age-related health, has been telling his patients for years. Walking the wrong way can quietly undo many of the benefits you are working so hard to earn. And the truly alarming part? Most people have no idea they are doing it. Dr. Pardip has spent more than 20 years working with patients in their 50s, 60s, and beyond. And in that time, one pattern has appeared again and again. People who walk daily, people who are genuinely committed to their health, still struggle with joint pain, fatigue, poor circulation, and declining energy. Not because walking failed them, but because certain habits, small and invisible, were quietly working against them. Today, Dr. Pardip is going to walk you through 7 of the most common walking mistakes people over 50 make without realizing it, and exactly how to correct each one. Stay with us through the entire video because the 7th mistake is one that Dr. Pardip calls the most overlooked health error he sees in active adults today. But first, let's talk about why your body after 50 responds to walking in a completely different way than it did at 30. After the age of 50, the body enters a new biological phase. Muscle tissue begins to thin out at a rate of roughly 1% per year if left unchallenged. The cartilage between your joints becomes less resilient. Your cardiovascular system requires more deliberate stimulation to stay efficient, and your brain, which depends on consistent blood flow to maintain memory and sharpness, becomes increasingly vulnerable to the effects of a sedentary lifestyle. Walking is uniquely powerful because it addresses all of these systems simultaneously. It is low impact, deeply accessible, and when done properly, it functions almost like medicine that you take with your own 2 feet. The key phrase there is, when done properly. Here are the 7 mistakes standing between you and the full power of that medicine. Mistake number 1. Launching into your walk without warming up. Picture a rubber band that has been sitting in a cold drawer for hours. If you stretch it immediately at full force, it snaps. Your muscles and joints behave in a similar way. Dr. Pardip has seen patients, people like a 63-year-old retired teacher named Ramesh from Pune, who develop persistent knee pain not from walking too much, but from starting too aggressively. Every single day, Ramesh walked out his front door and immediately picked up the pace. Within 3 months, his knees were swollen and his doctor told him to rest completely. The culprit was not the walking, it was the cold start. Your joints need movement to produce synovial fluid, the natural lubricant that protects cartilage. Your muscles need a gradual increase in blood flow before they are asked to perform. The fix is simple. For the first 4 to 5 minutes of any walk, move at roughly 60% of your normal speed. Let your body wake up gently. Then increase your pace. This one adjustment alone can dramatically reduce the risk of joint strain and muscle fatigue. Mistake number 2. Collapsing your posture as you move. Dr. Pardip often asks new patients to walk down the hallway of his clinic so he can observe them in motion. What he sees most commonly is a forward lean of the head, rounded shoulders, and a compressed chest. This posture looks small but carries enormous consequences. When your head drifts forward by just 2 to 3 inches, the effective load on your cervical spine more than doubles. That means your neck muscles are constantly working overtime just to hold your head up. Meanwhile, your compressed chest restricts the expansion of your lungs. You are walking, yet you are breathing at half capacity. Less oxygen reaches your muscles and your brain. You finish your walk feeling drained rather than energized. The correction Dr. Pardip teaches his patients is to think of a golden thread attached to the very crown of their head, gently pulling them upward. Shoulders roll back softly. the chest opens, the chin comes parallel to the ground, breathing deepens automatically. This is not about rigidity, it is about alignment. Your body was designed to walk tall. Let it. Mistake number 3, wearing the wrong footwear. A 58-year-old accountant named Vivek once came to Dr. Pradip complaining of hip pain that had been building for 6 months. He was walking 45 minutes every morning, disciplined and consistent. When Dr. Pradip asked him to show his walking shoes, Vivek pulled out a pair he had been wearing for over 3 years. The cushioning had completely collapsed, the arch support was gone, his foot was essentially landing on a thin layer of rubber with every single step. Over hundreds of steps each day, the shock that should have been absorbed by the shoe was instead traveling up through his ankles, his knees, and into his hips. Replacing worn-out shoes transformed Vivek's experience within weeks. A proper walking shoe should have responsive cushioning in the heel and forefoot, meaningful arch support, and a sole flexible enough to bend naturally at the ball of the foot. If your shoes are older than 12 months and you walk daily, it is very likely time for a new pair. Your joints will feel the difference immediately. Mistake number 4, walking infrequently and calling it enough. One long walk on a Sunday afternoon is not the same as 4 shorter walks spread throughout the week, even if the total distance is identical. Dr. Pardip explains it this way. Think of your cardiovascular system like a garden. Watering it once a week with a flood does far less good than giving it consistent, moderate hydration throughout the week. The body thrives on rhythm and repetition. When you walk regularly, your heart becomes more efficient at pumping blood. Your blood vessels remain supple. Your insulin sensitivity improves. These are not effects that appear after one long effort. They accumulate through consistent daily or near daily movement. Even 20 to 25 minutes of walking 5 days a week produces measurably better cardiovascular outcomes than one long walk on the weekend. Consistency, not intensity, is the foundation. Mistake number 5, letting your arms go completely still. Many walkers, especially those who are older, fall into a habit of holding their arms stiffly or letting them hang limp. Dr. Pradip sees this constantly. But natural arm swing is not optional. It is a functional part of human locomotion. When your arms swing in opposition to your legs, they stabilize your spine, reduce the rotational stress on your lower back, and engage your upper body musculature. That engagement means your heart is pumping blood to a larger portion of your body. More circulation, more calories used, better balance and rhythm. You do not need to pump your arms like a sprinter. Simply allow them to bend at the elbow to roughly 90 degrees and let them swing naturally in time with your stride. It should feel effortless because it is how the human body was designed to move. Mistake number 6, using your walk as screen time. Dr. Pradip understands that life is busy. He is not asking you to leave your phone at home, but he is asking you to keep it in your pocket while you walk. The moment your eyes drop to a screen, your head tilts forward and everything from mistake number 2 begins to happen again. Compressed spine, restricted breathing, neck strain. Beyond the physical, there is a neurological cost. Walking in a state of divided attention prevents the brain from fully benefiting from the natural stress reduction that rhythmic movement provides. Studies on mindful walking show that people who walk without digital distraction report significantly lower cortisol levels and improved mood after their walks. Your walk is 30 minutes in a day where your nervous system can genuinely recover. Let it. Mistake number 7. The one Dr. Pradip calls the most common and most ignored problem he sees in active adults. Treating the walk as the only thing your body needs. Walking is powerful, but it is one piece of a larger system. After a walk, your muscles are slightly stressed in the best possible way. They need water to flush metabolic byproducts and begin repair. They benefit enormously from gentle stretching. Even 5 to 10 minutes of simple leg, hip and calf stretches to maintain flexibility and prevent the gradual tightening that leads to injury over time. and your body needs occasional rest. Even the most active patients Dr. Pradip sees perform better when they allow at least one full recovery day per week. Recovery is not laziness, it is when the adaptation actually happens. When you sleep, when you hydrate, when you stretch. That is when your body processes the work you did and comes back stronger. Skipping this step is like planting seeds and never watering them. Here is what Dr. Pradip wants you to take away from today. Walking is not complicated, but it is precise. These 7 corrections, warming up slowly, standing tall, wearing supportive shoes, walking consistently throughout the week, using your arms naturally, staying off your phone, and honoring your body's recovery needs are not difficult changes. They are small shifts that compound over time into something extraordinary. Patients who implement them report better energy, less joint pain, improved sleep, and a sense of physical confidence that many of them had not felt in years. You are not too old to feel strong. You are not too far gone to feel well. The body at 55, at 60, at 70 still responds to the right inputs. Walking, done correctly, is one of the most powerful inputs you can give it. Dr. Pradip wants to hear from you. Of the 7 mistakes we covered today, which one do you think has been affecting you the most? Write it in the comments below. Your answer might help someone else who is watching. If this video gave you something valuable, please press the like button. It helps this information reach more people who need it. And if you want to keep building better daily health habits, subscribe to this channel so you never miss a new video. Dr. Pradip will be back with more clear evidence-based guidance to help you feel your best at every age. Your health is not behind you. With the right knowledge and the right habits, the best years of your physical life may still be ahead.